Well, the New South Wales health crisis, as we've been discussing, is worsening, and the state's paramedics have escalated their industrial action ahead of voting day on Saturday. They say they're sick and tired of being ignored. Well, joining me now is ABA New South Wales, that's the Ambulance Association New South Wales Delegate and Paramedic Brett Simpson. Brett, thanks for joining me. As a paramedic, how heartbreaking is it to turn up too late to someone's home when their medical condition has deteriorated to the point where they're fighting for their life?
Yeah, look, it's really heartbreaking, and it can be incredibly distressing, not only for the patient and their family members, but it does take a toll on paramedics as well. I've been a paramedic for 14 years, and I can tell you I've been in this situation countless times over that time period. I guess what it means for us is sometimes patients are sicker, and then, when they're not getting that treatment on time, it can mean their hospital visits and admissions are longer and more complex and ultimately more costly for the health system.
Look, what in your view is the actual issue here? Is it that there's not enough paramedics? Is it that there aren't enough physical ambulances? Or is it that the patients aren't being admitted fast enough at hospitals, and so, there's a backlog of ambulances there that can't get to more urgent cases?
Look, unfortunately, it's not just one issue. I wish it was just one issue. It would be much simpler to fix. What we're seeing is a multitude of factors in New South Wales. We're seeing a lack of paramedics and vehicles, like you said. We've got some of the lowest paramedic to population ratios in the country. But specifically a lot in regional areas of New South Wales, they don't have a lot of access to a lot of specialist paramedics like we do in metropolitan Sydney, Wollongong and Newcastle. So in regional New South Wales, having some of those extra resources are really important. Some of those paramedics spend a very long time specialising in skills that means that patients can stay at home. Our extended care paramedics can perform some very complex procedures to prevent people having to go to emergency in the first place. I guess the other thing that we're really fighting a lot at the moment is our pay and remuneration. I mean, New South Wales paramedics are the lowest paid paramedic workforce in the country with some of the highest costs of living. So unfortunately, whilst we're very pleased to see some massive recruitment happening in New South Wales, a lot of those staff are in fact fleeing to other states where pay and condition can be up to $20,000 or $30,000 in some cases.
Yeah.